They're protected by a extracellular polysaccharide substance. If they fester too long, lead to amputation.
Hello, everybody. Welcome back to another Tech Times exclusive. Today, we're talking to Next Science founder and CTO, Dr. Matthew Myntti. Now, what Next Science is for everybody, it's a medical tech company that specializes in infection prevention and treatment. Dr. Myntti, thank you so much for joining us today.
Thank you so much for your time, Chris. It's a pleasure to be here.
Absolutely. So let's jump right in. If you could please just, give us a little bit background on yourself and what inspired the creation of Next Science.
Yeah, so my PhD is in material science engineering, and I worked for about 8 years as the head of the biomaterials group at Medtronic Surgical Technologies, which was a great place to work, but I wanted to set out on my own and work on chronic wounds, which was the start of the company, which is an area that Medtronic doesn't really deal in. So I did leave and get funding to do that. And it was really inspired to help people to heal those infections, because those chronic wounds, if they fester too long, lead to amputation, which almost always leads to death of the patient. So that was the inspiration for starting the company.
Okay, I see. So I noticed in my research that you guys kind of, your area of expertise, I should say, or, specific expertise is the antibiofilm solutions. Could you maybe tell us a little bit about antibiofilm solutions and their importance to medical advancement?
Yeah, so bacteria don't exist as planktonic bacteria in the normal world. You don't ever see planktonic bacteria in a test tube or a petri dish. So what they really exist as are biofilms, which are protected communities of pathogens that are very resistant. And so when they form on an implant at your body or on a chronic wound, they are protected by a extracellular polysaccharide substance, which prevents treatment chemicals from getting to them. And it makes them very resistant to antibiotics, oxidizers, other forms of treatment because of that protective layer and the fact that those bacteria are down-regulated. So they're sessile, they're not as easily attacked by antibiotics and other treatments. And because of that, you have to structurally break them down, which is how we do it, which is different than everyone else. But the key is to break down that biofilm to actually be able to clear that infection.
Okay, I see. So you mentioned the antimicrobial resistance, and I understand, that there's been a continuing rise in this resistance. So what do you think are the primary causes for this?
Well, the biggest primary cause is overuse of antibiotics, I think, what you find out, because there's always a chance that bacteria is going to form a resistance gene, come up for some defense mechanism that can pass around. Biofilms do play a big role in this because you're getting a subtherapeutic concentration of the antibiotic to the bacteria within the biofilm. And because of that, those resistance genes and resistance mechanisms can form. And then within the biofilm itself, you start to see horizontal gene transfer. And that means that the bacteria are close enough to each other that they can pass between species. So you see these resistance mechanisms spreading around and increasing resistance over time.
Okay, I see. So do you think a lot of that also comes from, the way society has advanced, not only medically with the antibiotics, but also our diets, the fact that we don't really have to interact as much as, maybe 2 or 3 decades ago with, the natural world as far as like germs and all those things. Do you think that has a lot to do with it as well?
I can't really speak to that as much. I'm not a microbiologist or a physician who studies that so much. I think that's, definitely a possibility, but I don't want to get outside of my lane on that.
Right. Okay, no problem. What are the long-term effects of or dangers even of these infections if companies like Next Science does not, really try to get them in check?
Well, the incidence rate of surgical acquired infections, so surgical site infections, these infections that happen a long time, it's increasing. There's more and more people having these surgeries all the time. And with the commensurate increase in resistance, this takes a big toll. People who get a surgical site infection, for instance, are in the hospital an extra 10 days. They're twice as likely to die. So there's actually a great deal of mortality associated with these biofilm infections as they occur. And the long-term effect is you'll just see this greater burden on the healthcare economy and taking care of these patients, and on the mortality and morbidity of these conditions.
Okay. Yeah, I understand that. I think I've seen in the research that it's going to be a pretty drastic number, a pretty heavy number of people by 2050 if things are left as they are now. So
absolutely, millions of people a year dying from resistant organisms in that time period.
Okay, yeah, that's sad, but thank God, you guys are doing what you're doing. And speaking of doing what you're doing, can you tell us a little bit about XBio technology?
Yeah, so the XBio technology is the core of our antibiofilm technology that we out there now. Mm-hmm. And in all situations, that way that works is we have created a high osmolar condition with the surfactant and sometimes presence of a solvent, a small amount of alcohol, for instance. The way that works, I told you earlier about the polysaccharide is what's forming this encapsulating network that's protecting the bacteria and form the biofilm. Mm-hmm. Those polysaccharides are metal ion cross-linked. They would normally go into solution fairly readily, but they have these metal ions that are physically pinning them. So because we have a high osmolarity at a moderate pH, which is very well tolerated, it's normally at 4 pH, and we have an acid group that can grab that iron. So for instance, in the Experience product, it's citric acid and sodium citrate that form the buffer. So there's only 4 pH, but there's enough sodium citrate that the pH can be maintained. And because of that, the citric acid is able to form iron citrate and pour the iron out that is holding the polysaccharide together and allow it to go into solution. And it's that physical disruption that allows the bacteria to then be treated with the product. It's fairly easy to kill the bacteria once you remove the physical barrier. So then we can kill that with the presence of a surfactant and the combination with the high osmolarity conditions. So it's really the breakdown by specifically targeting those cross-linking points. That's the basis of the technology, and that carries through all the products we currently have on the market.
Okay, great. Well, yeah, speaking of those products, I'd like to take a minute or two, and let you tell the viewers and also myself a little more about, I think you have several products, but we'll talk about the top 3 right now. Yep. And we'll start, I think, from maybe we'll save the most recent for last.
Okay.
So yeah, if you could, tell us about BlastX.
Yeah, BlastX was the first product we came out with, and that again, this was to treat chronic wounds. That's where I started this whole thing. Was to treat chronic wounds. And that's a product, again, it's a citrate acid and a conjugate base that form the buffer. And then it's got benzoyl chloride, which is a cationic surfactant. And it's in a PEG gel. PEG is polyethylene glycol gel, chosen because it allows for oxygen transport. So you don't form anaerobes below the gel. And that product's applied to chronic wounds normally every 3 days or so. Mm-hmm. And we have clinical results showing that makes a huge improvement in healing of those chronic wounds. So these are your diabetic foot ulcers, venous leg ulcers, bed sores, see very good efficacy there, and saving a lot of limbs as we go along. And that's the BlastX product is sold for chronic wounds.
Okay, great. Yeah. So that's your antimicrobial wound gel. You said like bed sore things. So for just a sterile antimicrobial gel, you guys have Surgex. So maybe
so Surgex is the same thing as the BlastX product, but it's sterilized and comes in a sterile pouch, which allows it to be delivered to the surgical field. Mm-hmm. And then the way physicians use that, if they have a high-risk patient normally or a high-risk condition, like an orthopedic procedure where they're doing a total joint replacement, so you really can't have an infection get in there, they apply the Surgex over the primary closure, and that will prevent a biofilm from growing for 5 days. So you get this protection while the patient is most vulnerable, prevents biofilm, kills any biofilm that could be there. So you get that 5 days of protection so the patient can heal without getting a surgical site infection, which can actually then move down to the implant, for instance, which is a horrible outcome at that point. So that's what the Surgex is for.
So, and now for, I think, your most recent product, which is, an antimicrobial solution that's designed to help prevent infections all
Yep.
together. And it's Experience. Please give us a little information.
Yeah. Yeah. So Experience released in April. So so this is a product that's applied during surgery, and it has a sterile fluid path. It can be applied either by a bulb syringe or by spraying it with a Pulsovac type situation. So they actually wash the implant prior to closure or during the surgery, and again prior to closure. This is a unique chemistry. It's antimicrobial, but it can be left in the wound. There's no rinse out required, whereas the majority of other products have to be rinsed out with saline afterwards because they're toxic. The Experience product has the citrate and it has sodium lauryl sulfate, which is extremely well tolerated by the body. And what that means is you can leave it in there and it'll stick around for about 5 hours, preventing any biofilm from forming on the implant. And you close over the top of it. You leave a small amount in there coating the surface, and you close over the top, and that'll prevent hopefully infections again, you're looking at things like orthopedic implants, spine surgeries, those locations where you really can't afford to have an infection.
Okay, so it's basically replacing and I'm not going to say product. It's basically replacing what's the word to use? Process that was, maybe not as good as it could have been.
Yeah, there are products out there that are used to wash out that surgical cavity at the end of surgery, but they have no effect on the biofilm. So they're leaving that protective bacteria there, or they have to be washed out at the end of surgery with saline. Almost everything else has to be rinsed out with saline, so you get that ongoing protection after closure. That's really the unique aspect of this chemistry, is antimicrobial, but also extremely low toxicity, right, because we're not targeting the mammalian cells.
So with the biofilm, please let me see if I got this right, because myself and I'm sure a lot of our viewers are not as well versed, and it may it's not something we hear or discuss every day. But the biofilm is kind of like almost like an armor for these infections that just completely repels most attempts at killing it or whatever. So your products really remove that armor and then put the whammy, for lack of a better word, on those infections.
That's a decent analogy for it. Yes.
Okay, yeah. Good. Okay, just make sure I'm on the right page. So, I'm extremely interested always in, fields like research and development. I feel like that may be probably one of, if not the most rewarding aspects of a man's job. And I just want to ask you, since you guys at Next Science are doing incredible things, coming into a space that definitely needs advancements, that's continually evolving, but it doesn't seem to be evolving at the rate most would expect these days and time. But it seems like Next Science has come in and kind of been a catalyst maybe for change here, especially with the surgical infections. So how exciting is it for you to go to work every day and do R&D and for these advanced medical solutions?
It's absolutely very rewarding. We have a great mission. Everybody in the building's behind the mission. It motivates the employees. Over half the people at Next Science work in research and development. So it's really where we spend the majority of our time. We're an R&D company that now sells some things, but we're really a development company, and that's what people come in to do. The science and innovation is the focus every day, and that's way more fun than anything else we do, is we're actually in the lab working and trying to generate new products and new ideas. And I think we're at 36 patents now, wow, US and international. So we're a small company, we're not that old, but we generate a lot of new ideas. And that's really what drives us.
Yeah, I can imagine. So, especially when, like you said, it's rewarding, and it's kind of, of course you get that natural endorphin boost, when you're able, especially when it's doing the world good, like you work on this thing for months or years even, I'm sure, and then finally it's ready, it goes to testing, it's effective, and not only effective but efficient, And I'm sure that's just like, that's probably one of the greatest highs, you know, that a company could reach, especially in the medical.
Oh, yeah, absolutely. Getting the clinical data back, showing we're helping people, and getting we often get these testimonials where we've saved a limb, we've helped someone. That's why we do the work. And you know, it's great to have a business and you know, make money and sell products, but it's really, we're trying to help people, and that's what motivates everyone in our building. And it is the best part of the job.
Yeah, absolutely. I agree. I can definitely relate, or, you know, not necessarily relate, but I can understand that, you know, that would be, you know, I mean, that's why you're there, right? That's why you even went into this field. So to actually be effective and successful, and it's exciting to know that, you know, these products are out there for, you know, of course, not only me, but family members and friends. And, you know, I served for a few years, and that's a big problem, is, you know, being injured in, you know, in less than desirable conditions.
Yeah.
You know.
Yeah, absolutely.
Right. And, you know, what's the usual remedy, you know, is just, you know, wash it out and put some alcohol on it. You know? But
that doesn't always work, especially when there's other things that are left in the wound, right?
Right, exactly. Yeah. So I think these products are definitely something that is needed across the board. And I really look forward to what you guys have coming up next. So speaking of what's coming up next, if you could, if there's any Easter eggs or maybe clever hints that you could give us onto what's coming down the pipeline for Next Science.
We have a lot of very new and cool technologies we're working on, expanding beyond wounds and surgical infections into other areas. But I really can't speak to what those are, being a publicly traded company, until we're ready to announce that. But there's a lot of stuff in the works.
All right, well, that's good to hear. That's exciting. And please feel free when you can discuss, feel free to come back and let us in on it.
That sounds great. I'd love to do it. That'd be great.
Yeah, absolutely. So your products are, you know, now we'll get into the consumer side. Your products are for sale. How can people get these, especially like the antimicrobial gels, you know, that people could use probably around?
Yeah. So in the U.S. and I think everywhere else, those are all prescription only products that have to go through the physician. So the surgical products are obviously used in surgery, and then the Blastex product also has to be applied by a healthcare provider, or provided by a healthcare provider for use at home. But the consumer would have to have a prescription to be able to get them. Okay,
well, great. That's good, or that's, you know, that's good information. So yeah, for any of our viewers here at Tech Time Exclusive, you know, you heard the good doctor say, you know, if you're interested in these, and I don't know why you wouldn't be, because it just makes sense. Please, and I don't want to sound like an infomercial, but please, you know, talk to your medical provider and, you know, ask about Blastex and see if it's something that you know, that would benefit you in the long run, or maybe a loved one or something. So, Dr. Myntti, thank you very much for joining.
Thank you for your time.
Absolutely, it was a pleasure talking to you. And again, like I said, when some of these things come down and you're able to speak about them, please come back. We would love to dive in on those.
Thank you for the invitation. I look forward to it.
All right, absolutely. We'll be back with another episode soon. See you next time.
Thank you.
You just watched a Tech Times exclusive. If you enjoyed the conversation, be sure to subscribe to the channel, hit the like button, and share the video. And be on the lookout for upcoming exclusives with the world's most innovative tech companies. See you next time.